What's good, YouTube? It is your girl Dr. D back for another video, and I am doing a follow-up video from my 31 weeks. Basically when I was talking to you guys when I visit the pediatric heart specialist, and I always said I would come back and tell y'all the rest of what exactly she said. I thought that I possibly did this in the video. Y'all see I'm back in my happy place because your girl hip is hurting consistently, okay? And I am now 34 weeks and 3 days. So we getting close, y'all. And so basically what they said is that the baby's IVC is mildly dilated, which I forget that term, so while I have y'all, let me go ahead and transport. Anyway, so the baby's IVC is mildly dilated, which is a little large. What she said is that it is different, not abnormal. She also said that usually for a newborn or a baby that's baking in the oven, their veins usually come together like a Christmas tree. But my little guy's veins is coming together like this, collapsed. And again, it's not no abnormal, it's different. So if it was a problem, it would be in the pulmonary veins or the hepatic veins, which the hepatic veins is what drains the liver. But she's not saying any problems around any of those areas. She said that the IVC is right up under his diaphragm and the ductus, which is also called the ductus venosus. So any medical doctor who watches this video would know what I'm talking about more than I know what I'm talking about. I understand what she's saying when it's in terms of his health. She said it should go away after birth, and we'll see the doctor once he's born. So I don't go back to her so she can check on it anymore. She'll just wait till he's born to see it. And we'll go from there. If it was abnormal, then it would have been because of the pulmonary veins, which I said already. She said the structure and function of his heart and everything around it is normal. And if any other signs were off in those other areas, then she would have also said that something was really wrong with the IVC being mildly dilated. She also said that drainage usually is abnormal in the IVC, and that's usually what would cause dilation. So that could be the situation for my baby, but at a minimum, on a minimum scale. She says that everything is supposed to go to the left atrium, and that's exactly where things are going. The direction of everything is correct and seems normal. The structure and function, like I said again, is normal. And so basically at this point, I just wait to see her again when he comes. So I ask that you guys really just keep us in prayer. I know that I've been dealing with a lot physically, emotionally, and I'm going to do how to deal with your emotions in another video. But, you know, basically, I feel like during this pregnancy, a lot of things that has hurt me has hurt him. And I know that I've had a couple like just heartbreak of things happening that didn't go the way I planned on it. And I always feel like now, like I think about it and I say, well, I had a heartbreak. When I have a heartbreak, maybe he having a heartbreak. You know, because we pass down the energy to our babies. I'm still in pain, guys. Like, and when I take it off, it's almost like now I can't go without it. And I know that he's gotten pretty big. And let me see if I can show you guys my stomach size and everything now. He's gotten pretty big. Let's see if we can see. That looks pretty big, right, guys? Almost look like I'm having twins, but I'm not. Okay. Let me see. So I was reading something and it says, does your pregnancy have you crying like a baby? And what you can do about that. And what I learned is that, you know, there's things that helps us, that becomes hard for us to deal with, so it causes us to have mood swings. I was really conscious of having mood swings in the pregnancy with Dionna as well as in this one. But with CJ, I really did not care. Like when I tell you I was just like that BITCH, I was that, okay? I just was younger, about my thing. This is my baby, my firstborn. It is what it is. And I didn't really realize I was acting out as much, but I was acting out. Like if I wanted something, you need to go get it. If I need this, you need to go get it. You know, things like that. It might be just on the first pregnancy, the first trimester. I know I did cry. I think throughout this pregnancy, guys, I have cried when I didn't expect to cry. I had to tell y'all a story. So I went to one of my son's friends' graduation, and I only known the family probably a couple years. And all the moms got up and spoke because all our kids hang together and stuff. So I felt compelled to get up and speak myself. And I got up and I spoke, and I'm going to insert pictures from that day as well. So you can see how what I looked like that day, how big I was and stuff. So I felt compelled to get up and speak, but I didn't really know what I was gonna say, and I really should have just said something like, "We're so proud of you. I love that you hang with my son. Or, you know, you're a good kid. You're doing amazing things." And I said some of that stuff, but when I tell y'all I was breaking down like it was the end of the world, it wasn't even funny. And I think I was doing it because of everything I had been dealing with the tests and the doctors, at home, in my relationship, everything that was going on. I just felt like I was just losing it, guys. Like I was crying so hard that at the end she just said, "Mom, you would have thought he was one of your sons." But I cried so bad, y'all, and then through my tears, it's like, "And I love you," or the fact that you would have thought it was CJ graduating. I was giving this crying speech. So I gotta say that I have cried throughout my entire pregnancy, here and there, randomly, when I didn't expect. Okay, let me see what else. That sometimes you cry when you feel extreme happiness, to anxiety or fear that something will happen to the baby. And basically, when the lady was checking the baby at the pediatric, I keep wanting to say perinatal or prenatal, but it's the pediatric cardiologist or the pediatric heart specialist. When she was checking the baby, I realized that I was very emotional when she said that the baby could possibly have, what'd she say? When she confirmed that his heart was mildly dilated, I really, really, really just started tearing up because I didn't want anything to happen to the baby, and I felt like it was my fault. And I felt like, you know, things that I've been dealing with at home, in my relationship, in my house, with my family on the East Coast, so just feeling lonely at times, you know, when people don't understand you. That I was thinking that I put all of that on his heart because my heart was hurting. I don't even know if that's really possible, but guys, I felt some type of way. I really felt some type of way. But now you talk about starting over, especially when you have a 16-year-old son. Can we just talk about that for a minute? Starting over. Guys, starting over is just, there's so many great resources and things out now that I'm thankful for. But the whole idea of starting over has really had me in my head of how am I going to do this again? I'm older now. Am I going to be even better parent, worse parent, same parent as I was with CJ? I remember having CJ and just spending so much time with him every week, floor time. Does he know how to do this? Do he know how to crawl? Do he know how to do that? You know, in fear of him missing a beat. And I put so much time into him. And then Dionna came. It was my little baby girl. You know, I put so much time into her. And I still do for both of them. But how do I divide my time now? How do I have the same energy for another kid and actually putting a lot of effort and time into the same that I did when I had much more energy than I do now? Because during this pregnancy, like, I can actually yarn right now, or I could fall asleep like I'm tired all the time. I guess saying yawn makes me yawn. I don't know how that works, but whatever. But just, I've been just feeling like so many things, guys. Like, God chose me for a reason, and this little guy is about to be one special guy because I didn't want kids, and we have been through everything, as you guys know, because you've been following. But I just don't know what I'm going to do, and I know I'm going to jump right into motherhood like it was yesterday. I know that. But how am I going to deal with those emotions then? How am I going to deal with that balancing then? How am I going to deal with plans to actually... Ooh, he's kicking me. He's kicking my ass because I said that, huh? It's okay, baby. It's okay. we gonna have you now. But see that brain. Oh, I found out later in my second trimester, and because I found out so late, I was just stuck with emotions, and I had to get into the doctors, and I was in like 2 or 3 appointments a week because they started seeing things happening with the baby. 1 week he was fine, and then next thing you know, it was just stuff going on. And I did not feel like I was ready or was capable of having another kid. I think I was definitely, yeah, that's the word right there. Being at my age and everything, and you guys got to check out the video I did where I talk about how I found out and the age I am and stuff like that, if y'all want to know. But I had already had an appointment set up for an abortion and everything, guys. Well, not to set up for an abortion. It was actually set up to meet with the abortion counselor. I had already called and did my quotes and stuff like that. Like, I kind of was for sure that this was the direction I was leaning towards, right? So I thought. And then I found out the week that I was scheduled to go there, I had a high-risk appointment, and the high-risk doctor say, no, you need to get in. You're about to go in surgery. You got to go because you are about to deliver. So I felt like that was God's way of helping me keep my baby. Despite everything I was feeling, it was like his calling and not mine. It's always his decision and not mine. And I just felt, but you know, that week was the same week, so I never made it to the abortion appointment. And I actually met a guy for high risk, and he said, we got to rush you to the hospital across the street now. And I'm like, no, I got to go home and feed my kids. I got to do this and that. I was just like, my kids are waiting on me. They waiting on food, and I got to go get them situated. And he was like, no, you're going to have this baby. And I said, I'm going to just pray on it. I'm going to drive home real quick, check on my kids, get them settled, and I'm going to let God take over and just pray that I'm not going in labor. And that's what I did. My babies needed me. They were waiting for me to come home, and I had to go and explain to them that I was going to surgery and that I had to rush back to the hospital to have surgery. And I also thought that if I got away, that possibly I had a few minutes to decide on should I go back. But they were calling me, and they were saying, you need to get back up here really quick and stop procrastinating. So it was like I had lost all the weight I had since Dionna, and I started gaining it back, and then almost like maybe 28, 29 weeks, I think I was really like losing a lot of weight. Loss of interest in favorite activities. I mean, I can't say that's the case for me because I really haven't had any favorite activities that I couldn't do. I just feel like I've never had enough time to do things. Like if I wanted to film a video, if I wanted to get some work done in my office, I couldn't do it because I'm tired, you know. Just tired too quick. So that creates some kind of depression for me. If I can't work, I feel so like a loser. And I have to tell you, this pregnancy has not been motivating for me in terms of getting things done because he is in control and he got me tired. Like, I'm just really tired. And it's my age too, guys. Feeling of worthlessness. Nah, that's not really it. I feel like when I can't get work done, I'm just irritated because I'm unmotivated. And I feel like you should always be motivated 24/7 for this guy to stay in a little longer. Even though it's causing me more problems, I just got so much to do. And the last one is thoughts of harming yourself. I didn't really feel that. It says sometimes depression during pregnancy is fleeting and resolves on its own, but if symptoms last 2 weeks or longer, speak to your doctor. Some of the things that they say we can do. Oh, look, it says, can crying and depression affect an unborn baby? isn't likely to harm your unborn baby. So having an occasional crying spell isn't likely to harm your unborn baby. So I bet that's the same thing with the heart thing too, but can't help to think that way, guys. Okay. How to treat your crying spells during pregnancy. Get enough sleep, which we just talked about. Be physically active. I am active as much as I can without losing my breath. Now I jump up too fast and I go to the kitchen and I'm like leaning on the wall. So what my son has been saying, Mom, stop getting up too fast, because I want to just go fast like I used to. I can't be physically, excuse me. I can't be physically active like I was before the pregnancy, as in working out every day, because they don't want me doing none of that stuff due to having an incompetent cervix. Talk to other moms or pregnant women. I'm a part of a group called Black Infant Health, and there are maybe 8 moms in there that's pregnant, and then the leaders who are pregnant, and one I think that doesn't have any kids. But it's been an amazing journey meeting with them. At first I was like, oh my God, I don't want another meeting with other people. I didn't even know there was all these resources available. Black infant moms, that's a part of this same program, and I meet with them on Tuesdays for 2 hours, and it has been really a great outlet. Really it has, guys, and I'm so thankful for these ladies and anybody who's watching my YouTube channel that's from that group. Thank you. Shout out to you guys, because I don't know if I would have done as well without having you guys in my life. I feel like it wasn't my thing. I was just like, goodness, I got too many meetings already, but it's been great. Let me see. Don't overwhelm yourself. Yes, preparing for a new baby can be overwhelming and stressful. And I have been really overwhelmed the closer I get to this, because I don't know when he's going to come. We have a scheduled C-section date, but when they take the cerclage out, there's a possibility he can come. So I have to begin packing my bag like ASAP, and that's going to be another video I do with you guys, packing my bag, because it's been a long time, and I had to get a list from the doctors, or matter of fact, I think it came from the Black Infant Mom program. So I just can't remember what I need to put in that bag. And a lot of stuff you got to put in the bag, guys, it's like you need it still until that day. So it's like I may need to put it up on the wall and say, okay, grab my robe, grab that, you know. So that's one thing. But that's basically it, y'all. This is pretty much the end of this video. I think we have been on here quite a while. And I want you guys to like, comment, subscribe. I thank you guys so much for just being on this journey with me. The love, the prayer, support. And hit that post notification so you don't miss my next video. And basically, that is it. We out.